Now, I will be talking about the correlation between a SARS-CoV-2 infection and asthma and mild symptoms. Allergies and asthma are inflammatory respiratory conditions. Other respiratory conditions and pre-existing medical conditions have been reported as risk factors for SARS-CoV-2. However, asthma and allergies being present in COVID-19 patients have been underrepresented. A study was conducted in Seattle in February 2020 with 24 severely affected COVID-19 patients. Of these 24 patients, only 3 had asthma as a pre-existing condition. Another study was conducted in Wuhan with 140 hospitalized COVID-19 patients. Of these 140 patients, none had asthma as a pre-existing condition. In a later study published as a preprint online involving over 16,000 COVID-19 patients, only 14% listed asthma as a comorbidity. According to state officials, 5% of COVID-19 deaths in New York were of persons who were also reported to have asthma. As with most of the research concerning COVID-19, the evidence is limited, so we cannot confirm the reason for this. Although health experts say that there's little to no evidence linking asthma to COVID-19 as a risk factor, they still agree that asthma patients should continue to take their medication in order to keep their symptoms in check. An English cohort study was done on a sample size of 17 million COVID-19 patients. It was found that those with asthma showed increased risk of in-hospital death. The risk was higher in those with recent oral corticosteroid use than in those without recent use. Corticosteroid use can be considered a factor for disease severity in asthma. However, inhaled corticosteroids, when taken as prescribed, may lower the risk of an asthma attack triggered by respiratory viruses such as SARS-CoV-2. In April 2020, a study was done that hypothesized the reason for asthma not being listed as a risk factor for COVID-19. This could be due to the decreased expression of the ACE2 receptor in the airways of asthma patients. They found that the ACE2 expression was lowest in people with high levels of allergic sensitization and asthma. Therefore, persons with both of these conditions would exhibit less severe symptoms. However, it was found that there was no significant reduction of the ACE2 expression in persons with asthma if they did not have allergies. Due to the fact that asthma is an inflammatory condition, some scientists believe that the immune response might provide potential protective effects against COVID-19. In addition to this, treatment for asthma may reduce the risk of infection and/or symptoms by alleviating inflammation or enhancing antiviral defense. It should be noted that there are some seasonal coronaviruses, like those that cause the common cold, that may cause exacerbation of symptoms in asthmatic patients. However, the SARS-CoV-2 virus does not seem to do this. Nonetheless, it is always important for asthma patients to keep their asthma under the best possible control. In this way, their lungs would already be best prepared in the event that any allergen or infection exacerbates their symptoms. In conclusion, keep doing what you've been doing all along. Continue to take your medication and alert your physician of any symptoms that you may develop. And of course, remember to practice social distancing and wash your hands. So as of June 28th, this information is accurate, but more research needs to be done, like I said. Thank you for listening.